IVF. It is a common concern that most of the patients have especially when they have been trying for some time, whether it's time to start proceeding with fertility tests or whether it's time that they should proceed with a fertility treatment. I think whether a patient needs fertility treatments, whether it be IVF or any others, really depends on how long you have been trying for or the duration of the infertility or infertility. The other aspects would be, are there any other risk factors in your clinical assessment that increases the risk of having either a male infertility or a female infertility? So based on these two main factors, really depends as whether you need fertility treatment or not. With regards to the duration what you've been trying, if you are just less than 35 and you've now been trying for less than 2 years, then probably you can try naturally for a bit longer. If you're anxious and want to proceed with the fertility treatment, you can considering simple treatments such as insemination rather than proceeding straight with IVF. However, if you have been trying for 2 years or more, then yes, IVF probably is the right treatment for you. If you are over 35, we understand the implications of the age on the fertility, either naturally or that following the treatment. So therefore, if you're trying for over a year, then it is time that you should seek further advice. It also depends if you've been experiencing any symptoms such as irregular cycles or absence of periods, which leads to anovulation, or if you have past history of chlamydia infection, or there is history of moderate to severe endometriosis, or you have had extensive pelvic surgery, or you have had a past history of a burst appendix leading to a major surgery, or there are genetic conditions such as Turner syndrome or MRKH syndrome, then it's likely that you might need fertility treatment even if you've been trying less than 2 years. On the other hand, if you do have family history of such as premature or menopause or premature ovarian failure or autoimmune conditions where this might have been suspected, then in that case it is important that you seek advice early. When coming on to assessing your partner, it is also important to see whether there could be any history related to your partner, such as any medical illnesses, diabetes, autoimmune conditions, any past history of infections, non-gonococcal urethritis, chronic prostatitis, or there can be use of anabolic steroids, testosterone supplements. These are the factors that can affect male fertility, and therefore early advice would be suggested in such cases too. So therefore, in summary, really, it really depends on how long you have been trying and what the detailed clinical assessment will suggest. If you think there is a reason to believe that you may have a risk factor for fertility and you're anxious, you then should seek help early rather than stress yourself thinking about the issue.